Good afternoon. Welcome to the 12th Annual Air Quality and Health Workshop held in Vancouver, put on by the British Columbia Lung Association. My name is Veda Peters. I'm staff with BC Lung Association, and I'm here with Dr. Jat Sandhu, who works for Vancouver Coastal Health, and we're going to talk about a case study for public transit. So what changes are proposed for Vancouver in the upcoming referendum?
So the Mayor's transportation plan for Metro Vancouver actually has a number of investment options related to rapid transit as well as existing bus service increases as well. It's quite a comprehensive plan in that it covers improvements to existing levels of service in rapid transit and bus service, but also investment in new service lines as well. So in addition to supporting investments in public transit, it also has investments for cycling and walking paths, as well as improvements to roadways as well. So there's something in the plan for everyone.
That's good, because most people, when they talk about public transit, assume that you mean more buses.
Yeah, so the transportation plan is worded to recognize that the commuters across Metro Vancouver have a number of options at their disposal, of which nearly more than half use cars, but quite a significant proportion use a mix of transit, walking, and biking as well.
So based on your research, how would those proposed changes affect health in the region?
Right. So part of the work we did at Vancouver Coastal Health was to jointly conduct a survey with Fraser Health and UBC to examine the health of the communities across Metro Vancouver. And we asked in this survey that was conducted during 2013 and 2014, what was people's regular mode of commute for work or school? And from that, we realized that close to 55% of Metro Vancouver residents use their vehicle for commuting to work or school, and 43% use active transportation modes. So the active transportation includes transit, cycling, and walking. Now, we decided to examine whether there were any differences in health and health behaviors between those that use active modes of transportation versus those that use car for their commute. And we did find some significant differences. We found that, first of all, compared to car commuters, active transportation users were less likely to be overweight and obese, more likely to meet their kind of weekly physical activity guideline, and more likely to just generally have healthier lifestyle choices all around. So these were fairly significant findings across Metro Vancouver, and at the same time, consistent with what's been seen in the broader literature from other jurisdictions as well.
Well, from personal experience, I will certainly admit that the worst thing that ever happened to my health status was buying a car, because I don't walk anywhere, which is really kind of sad, but here you go. So what's going to happen if the referendum doesn't pass?
I think that's a question that others may be better positioned to answer, but what I would say is that the investment as proposed by the Mayor's Council has something for everyone across the Metro Vancouver region. It doesn't matter what mode of commute you use, there's something in there for everyone. And we're all reliant on, to a certain extent, on people that use transit for something that affects your life, whether it's somebody that you employ, somebody you work with, or somebody that you socialize with. So I think transit is there for everyone, to a certain extent, serves their needs. But what I would say is that if we take a longer term and a broader view to this investment, I think there is potential to create a more equitable environment across the Metro Vancouver region, because having access to transportation, and in particular transit, also is an access to equal opportunities in terms of education and employment opportunities across the region. I think if a no vote was to prevail within the transit plebiscite, I think we will probably still see some investments being made, but they probably won't be coordinated or laid out in the way that the Mayor's plan has envisaged.
Do you think that if the information had been presented in terms of more, not only does this benefit your health, but benefiting your health saves dollars per investment, would that have helped to make a difference?
I think, obviously, if we can put some economic figures to the benefits of active transportation or these investments on the health of the Metro Vancouver residents, I think clearly it would make a stronger case. But that work is still probably coming from other jurisdictions where they do have the capacity and resources to look at that in more detail.
Because for me, I was just thinking that that would be something that would resonate with me more strongly than we need this money to do this.
I mean, I think Metro Vancouver residents often like to trumpet how we have one of the best quality of life in the world. You know, we constantly come out top of the rankings. I'd like to think that the residents would also like to see a more equitable environment that supports all members of our communities.
Well, thank you for the work that you're doing and your participation in the workshop. It's been very informative, and I may have to change my position on a few things.
Thank you for the invitation.
You're welcome.